This is Providence Television International, the toast of today's television viewers. Don't be left out.
Good day and welcome to the interview segment on the Morning Drive Providence Television International. My name is Ugbebo Ikekwa, and with me in the studio is Dr. Emmanuel Igariba. You're welcome.
Thank you very much. Always a pleasure of mine to be here. Yes.
And so this is a wonderful morning. We'll be looking at the topic healthcare development in Nigeria, the way forward.
The way forward, the government knows the way forward. Yes, government knows the way forward. It's just the will that is absent. Yes, and everybody knows this. For example, and the saying goes like this: a healthy nation is a wealthy nation. When you have a population that is sickly, how can you have development? You cannot. First of all, there are issues involved. One, where are the facilities? Facilities are not there. Our medical doctors just manage to go through medical school. They just manage, relying just on theory. Okay? But surprisingly, to God be the glory, when they go out of this country, they still excel. Because many countries around the world know that Nigeria was once a citadel of medical education. Yes. We had Dr. Baza here the other day. He went to the University of Ibadan.
Yes.
And he said people were coming from all over the world, from US, from Canada, from Japan, to come to the University of Ibadan to come and study. That cannot happen anymore because the people out there around the world, they are not sure any longer of what is happening here. But time was when they were coming. Even in my secondary school days, people were coming to come and attend secondary school. I'm talking of Edo College. Okay, so but it's quite tragic. The facilities are not there. I'm not even too sure now if we have the best of teachers in the university. We could, yes. People who have decided to stay behind to teach these young people, yeah, we could have them. But to compare with what used to happen, this is a country that has put, I can reel out the names for goodness sake. I'm Professor Lambo, for instance, who became the president of WHO, from this same country. Professor Osejolimi Thomas, who was VC, by the way. Professor Audu Bako, these were great people produced from this country who excelled all over the world. They are icons. These are iconic figures in medicine. All right? Professor Likoyi Ransom Kuti, yes, a great pediatrician. I'm talking like this because my father worked in the hospital system all through his working life. And I used to study him, to watch anytime I went to visit our general hospital in Lagos. We had good people. Professor Bello Sage, well, we cannot replicate them. It's not possible. These people, they are gone. It's a forgone generation. How can we replicate the people I've just mentioned? And yeah, the same country. The same country. So here we are. And health should be number one priority. Apart from power, which I just talked about, and security probably. Health, the welfare of the people, that's what the Constitution says. It's a legal issue, by the way. It's a constitutional issue. The welfare of the people also means that you have to look after their wellness, in terms of health. But we are glossing over it. Go to our teaching hospitals. Many of them, nothing. Nothing. Okay? What's the ratio now? One doctor to how many people? And where are the consultants? Where are the consultants? There are many disciplines in medicine. If you go around the country, there are no professors for some of these disciplines. No. How many cardiologists do we have all over the country? How many cardiologists? How many ophthalmologists do we have? How many dermatologists, skin? How many do we have in this country? I'm not even talking about neurosurgery. That's a no-go area completely. How many do we have? But yet, when they go outside, the people outside, oh, you are coming from Nigeria. We used to have a very good report about Nigeria. That's what keeps them abroad. And they excel, by the way, because they now come face-to-face with facilities. Remember what Dr. Baza also said, that, look, some of people here, they look at their colleagues performing wonders. How many open heart surgeries have we had in this country? Tell me. Open heart surgery, and which is very common. Anyway, very common in Europe and the US. Very common. They have the facilities. Medical doctors are living in droves.
Yes. That's a brain drain now.
Yes, they are living in droves. That's why somebody said jokingly the other day, very soon we'll be left at the mercy of native doctors in this country. And it's almost coming to that. Native doctors. Those are the people who will be looking after us. Because orthodox medical doctors are all away. How many doctors do you find in teaching hospitals now? Very few. How many professors? They have all gone. Time was when they were going to Saudi Arabia. Saudi Arabia is gone now, but they are going now to Western countries. Yes, in droves. The other day, we had a figure of about, I think, 20,000, in the UK axis alone. I'm not talking of all over Europe. I'm not even talking of Canada. I'm not talking of US. I'm not talking of Asia. Even China is now beginning to absorb Nigerian doctors. That will shock you. So, one, facilities, the teaching staff must be encouraged. Yes, must be encouraged. Have you ever bothered to ask, why is it that private hospitals, many of them, are doing relatively well in this country? Yes.
Better than what the government
is. Better than what the government is supposed to be doing. They're doing well. They build Fantasia, and people come to them because they need expert medical services. Go there. I know of some private hospitals that even have departments so large. They have psychiatry, they cater to psychiatry, ONG, all right, dermatology, they have experts in private hospitals looking after people's interests. But if you go to government hospitals, almost reduced to nil. Almost reduced to nil. So we must do something very fast. I must encourage the doctors, put them on a special scale. Yes. I understand that the medical officer is now on level 9. Why can't we start them on level 10 or even 12 to keep them back home? Yeah, because they are dealing with life. They are dealing with life. They are dealing with emergencies. All right?
Okay. This particular point, what you just said, that they're dealing with life, though, it brings me to my next question. Yes. We've had incessant strikes in this country, and the health sector is actually planning to go on strike in a few days, as the case may be. Should medical doctors be involved in strike actions?
Well, I said that you asked me a few days ago, and I think I answered your question directly or indirectly. And I said, look, they are human beings, okay? They are human beings. They also need to live a good life, okay? They see their colleagues elsewhere. They must live a good life. In any case, they really do need to live a good life so that they can help in the process. For instance, if a doctor is sick, how does he take care of patients? Yes, particularly if he's a surgeon. If he's not comfortable, he takes a knife and he opens up. If he's not comfortable, he does the wrong thing. Yes, because he's mentally disturbed. Yeah, particularly for very critical surgeries. He does the wrong thing because he's a human being. But they must be paid well.
Okay.
They must be paid well. That's my take. They must be paid well because they are dealing with life. As to your question, should they go on strike or should they not go on strike? That is... it's relative, right? Because all through my years when I was growing up, doctors never went on strike.
Okay.
They never went on strike. In fact, it was unheard of for doctors or even nurses to go on strike. No, it was unheard of because they were paid adequately. Okay? They were even given quarters. Yes, quarters. And this will also shock you. Our doctors who studied abroad in those days, they were quick to come back home, to come and help in the development process of Nigeria. They were quick to come back. Now the reverse is the case. Once they graduate now, they want to japa. You're talking of health workers. That includes medical lab people.
Yes.
It includes nurses. It includes all kinds of paramedical staff. They want to go abroad because they are needed. Their services are needed outside this country. Yes, it's not as if to say what they are doing is the right thing to do. But let's face it, people also need to live a good life. I know some doctors who walk around the streets barefoot. Why should that be? Why? Doctors. Yes. And yet, the tragedy of it is, some of them want to risk it. They go to private hospitals How much are they paid? I don't want to talk about it because it's very scandalous. Doctors, how much are they paid? Little, less to nothing.
Okay.
Next to nothing in some of these hospitals. Yes.
All right. Well, we'll leave that hanging. Let us come, just before we go, healthcare schemes in Nigeria.
We have the National Health Insurance Scheme, don't we? How far-reaching is it?
Exactly.
We must ask ourselves these basic questions. What is wrong in people having health insurance all through? Even when you're a peasant farmer, you're a petty trader. Those petty traders, they cannot access the National Health Insurance Scheme.
Exactly.
No, they cannot. And yet, health is the key. Health is the key. Look at people who suffer from diabetes and all that. Only God is saving them. Okay, because the drugs are expensive. Hypertension, the drugs are expensive. They cannot access these drugs. Ordinary malaria. Do you know with the economy now, people cannot access? Yes, and that is part of the healthcare delivery system. Yeah, they can ordinary malaria. If you go to the private hospital, they give you a bill that you cannot even talk about. And yeah, these are simple things that you can access very easily. All right? Drugs for mental illness or illnesses, you cannot access them. They're expensive. Whereas government should do right to say, look, these drugs should be free from excise duties, and things like that. Yes, for the sake of the people. All right? Pregnant women, I know some states did that. I don't know if they have stopped now. Pregnant women should have free access to medicine and treatment in the hospital. Delivery should be free. Yes, to a very large extent. Delivery should be free. I mean, particularly for peasant people, it should be free. Yes. A lot of people, women still suffer from eclampsia, and things at the point of delivery. Going through harrowing experiences. There are certain aspects of healthcare delivery that should be free. For instance, certain categories of drugs should be free. And then, of course, we must go back to our herbs. We must go back to our herbs. I said it the other day, there's a branch of pharmacy, pharmacognosis, that deals with the efficacy of herbs. We must do research. Where are the research grants? If you must do research, there are professors of pharmacy. They are just locked up in the university. There are no grants. So that they can do thorough research into this. And I think that we must move away quietly, not too rigorously though, move away quietly from orthodox drugs.
Okay.
Yes, there are herbal drugs that are working like magic. I know a lot of doctors will not like what I'm saying now, but that's the truth, because they criticize acupuncture from China. But today, acupuncture holds the ace in many private hospitals that I know of. Yes, acupuncture. Yes, but it was highly criticized, terribly criticized when it was coming up by the Chinese. Okay, so we must go into those areas and see how we can synthesize traditional medicine and orthodox medicine. Let us put them all together, because there are certain things that we can gain from traditional medicine. Right? Oh, many. Yes, a lot that we can gain. Let us bring them all together, and create a synthesis of both. That is where some countries in the Western world are different. They bring all of these things together, and then you chart a common cause. But to condemn them outright totally is wrong. Because till today, as I'm talking to you now, there are certain things that our forefathers did that are still potent. The fault would be that, okay, they didn't pigeonhole some of these things. They didn't put them down in black and white. But they work. They work. So we must bring them together. My happiness is that a lot of Western-trained doctors also believe in the efficacy of those things. Yes, they do. And they will tell you that, look, I'll give a typical example. I have a doctor friend. He had a case of anal fissure. Anal fissure, which some people will call pile and all sort of things. You know what he said? There is this leaf, I don't know the name. It is used by native women. They plug the leaves, and the liquid from these leaves, the drops from this leaf, they put it on navels
Okay.
Levels of newborn babies. And the thing heals perfectly. So he now told, this is a doctor talking now, he now told one of the patients, you tried that.
Okay.
Yes. In the anal fissure, yes, it was painful. But he dropped it in that part of the body. And within a week, it was gone.
Wow.
It was gone. That is from traditional medicine, which we could easily incorporate into orthodox medicine. There must be a good mix.
Okay.
Don't let us condemn totally what is happening in traditional medicine. They have their efficacy, of course, right? I don't want to mention the areas, but we know them. We know them, and they work. They work.
All right. Thank you so much, Doctor, for coming on the program. Viewers out there, I know this has been quite educative and entertaining, informative also. I would like to go on, but then we'll have other programs coming up. So on this note, I want to wish you a wonderful day ahead, and please stay tuned.